People's biggest fear about lips is not how bad it's gonna hurt, but what's the outcome.
And is there a reason that we don't do it there?
Yes.
Okay, Lindsay. I hope, Lindsay, you're watching this.
It's not safe. That should be soft tissue. We don't want anything semi-permanent. It would be a disaster to dissolve.
I love what you said about safety, and I think that's where we all approach this. Number one, we have to make sure that what we're doing is safe and achievable. So Jerry, do you want to explain a little about what the Hyalopin is? And know that in 2018 that the FDA did issue a warning. So this is not something we're just dealing with. Hi, and welcome to Beauty and the Brain, the podcast where we discuss all things aesthetics. I'm your co-host, Dr. Chris Croley.
And I'm Jerry Drinkard, family nurse practitioner, and together Chris and I own Skin and Tonic, med spa that's located in Pace, Florida. Today we're joined by our nurse practitioner that works with us, Allie Ballew, and we're so happy to have you with us today.
Hi again.
Yeah, Allie's like one of our regulars now, so she's here enough. Many of you guys know her. She's worked with us now for almost 2 years at Skin and Tonic. And so really happy to have her here. So both of these guys here, so Jerry and Allie, are really, really passionate about doing lip filler procedures. So we're gonna give them a platform today to talk about this. And I'm gonna kind of go over some of the things that I think we get asked a lot and some of the things I'm a little bit curious about. Briefly before we start, I can tell you that, we've been doing lip fillers now for almost 15 years. But when we first started doing this, it was not nearly as popular as it is right now. And I can also tell you that I personally hated doing them. Those of you guys who have known our story or followed us along, we started in Chicago, and in Illinois, nurses could inject. So as an RN, Jerry injected there. But when we moved, the laws were a bit different here. And so I was the only one that could do injections while Jerry went back to nurse practitioner school. So for a little bit, he was like running everything at the med spa, and he would fill my day up with lip injections. And I was ready to have a heart attack and choke Jerry out at the same time. Because I'm like, why did you give me another set of lips?
But lips are important.
Lips are important.
With lip patients, you have two populations. You have Allie's age group and you have our age group plus. And I think for Allie's age group, I think a lot of it is driven by social media. And we'll talk a little more about this, but I think that lip is really important in full facial balancing in an older population. And so I think it's one of those things that people's biggest fear about lips is not how bad it's gonna hurt, but what's the outcome? Are they gonna look strange? They don't wanna look like some of the people that they've seen before. But once you put those lips on them and they realize how much more balanced they look and how much more youthful they look, then they're so happy. And so I think it's just a really, really important feature. It'd be almost like not having freaking eyebrows. How weird is that? So you put a pretty set of lips on someone, give them a little volume back, and it just makes you feel good.
Yeah. I just hated doing it because back at that time, I don't know that we had as much training. There was, and maybe there was out there and we just didn't know, but there was a lot of trial and error. And I look now at what we're able to do and what we're able to teach with the different techniques to really create beautiful shapes, to create symmetry. And we have perfect products that are designed just for the lips.
I think that's the biggest difference is now like Allie's coming into this and she has like at her fingertips some of the best products that have ever been released. And so what makes lips your favorite?
I think it's the instant result for one. It's not something you have to be like, oh, come back in 6 weeks and we'll see what they look like. You get that instant gratification, a little swelling, but other than that instant gratification, I think that I like getting to work with all different age groups, like you said, and they all want something different. And so that's what I love. It's like, it's not just another lip filler. It's a whole new client, a whole new set of goals, a whole new preference. And so I always make sure, and talk with my patients about, do you want a Cupid's bow? It's kind of getting popular now to smudge out the Cupid's bow. Do you want two big pillows or do you want a continuous bottom lip? There's just different things. Do you want more height in your upper lip or just some fullness? And so there's a lot of different things and ways that you can go about doing lip filler. So I get so excited every time because I'm like, I'm going to get a new set of lips and I'm going to get to create them and mold them and structure them differently than any other set of lips I've ever done because everybody's so different.
Well, it's interesting because, as Jerry said, facial balancing is so important. And so I think we see both extremes. And so patients come in and maybe they want very large lips, but that may not be natural for their face. So there's a bit that we have to kind of respect what goes on with them natural. But then I think more often than that, what we hear as a common fear is that their lips are going to be overdone. And so when we start discussing lip goals with them, everybody is afraid of having something plastered on their face, front and center, their lips, that look unnatural. So how do you reassure your patients, Allie, that you're going to respect their natural anatomy and not over-augment their lips?
I always tell them I'm a natural, pro-natural, enhanced gal myself. I always tell people my preference is she blessed with great lips, or does she maybe have a little bit of filler, or is she wearing lip plumper? Did she overline them today? And so that's kind of what I generally go for. You do have your few who like the very dramatic look, and you can talk to them about it and everything. But I always tell them, the products too, like that are made specifically for the lip area is going to have a natural look, a natural feel. It's not something that's going to bother you or get in the way of anything. People will not name drop as much as anything as when they come in to get lip filler. They will name drop 8 people from their hometown and be like, I do not want to look like this. I do not want to look like this. And I'm like, okay.
Or I want to look like so-and-so.
Or right? I want my lips to look like this person's. And the most common when you get the celebrity ones, like I do not want to look like Kylie Jenner. And something that I always tell people to kind of ease their nerves, I say, I don't have enough talent and I don't have enough product in the syringe to make you Kylie Jenner.
Yeah, because many people think she's beautiful, right? And so we have some of our young girls come in, it's like, I want to look like this.
Absolutely, and there's not enough product to do that in one syringe, and I don't do more than one syringe in one session. I explain that to them as well for migration purposes and just safety.
So Jerry, what are your thoughts? I know that you and I have a couple of patients together that we've seen that are a little bit over-augmented or overdone. So how do you deal with those patients? Do you comply and put more filler in when they come in? Do you talk them out of it?
I think that's when your overall assessment comes into play, and it's not just an overall physical assessment. I want to be sure that I'm treating the patient safely. That's my first goal, that I'm giving them what they want. But I don't want to treat someone that I feel is not mentally able to handle it. I say that just based on there's so much body dysmorphia now, and so we do a lot of education with our patients. And so whenever they come in, if they want to be overfilled and it's, or they want to be overly augmented, I guess is the best way to say it. If I think that the patient is stable, I think that their lips can handle it, I think it's safe, then I'll do it.
Yeah. I mean, I think we kind of feel the same about this. I think it's really important, and this is one of the things we talk about with new injectors, and when we teach our lip classes, I think it's really important early on that you kind of establish what your look is. And I went to a really kind of fun, they did a Galderma Train the Trainer event recently, and one of the things they did is have all our signatures that somehow they pulled from 1 million documents that we submit over time, and they quickly flashed it on this big screen. And they pointed out how your eye immediately goes to your signature. So mine was up there with 100 other people, and immediately I recognized my signature. And it's kind of the same with our aesthetic work. We have certain things that we're known for, our cheeks, lips, whatever the case may be. And so you want to be really careful early on if you're doing a lot of these overly augmented patients, because you're going to get known for that. It's going to be your look. Whereas I think all of us are in agreement, and it's kind of our practice philosophy in general, that we try to really augment your nice features, but do this in a way that respects your natural anatomy. But we do have a handful of patients that we have fun with. We love those patients, and they are overly augmented.
My overly augmented patients, they're going to put your name on it too.
Yeah, they're going to let everybody know you did it.
When they get their lips done, they do their Instagram live. Yeah. They always tag me in their reels. And probably 5 of my favorite patients to see, and I think they're absolutely beautiful. They are slightly overdone for what I would choose for them, but it matches their personality. It matches their line of work. It matches the image that they want to put out there.
And so, I mean, I love what you said about safety, and I think that's where we all approach this. Number one, we have to make sure that what we're doing is safe and achievable, and we have to make sure that the patient has realistic understanding of what we're doing. I think body dysmorphia is really important, and so we do have ways that we screen for that, ways that we look for that, and pretty much for those of you who are not familiar with that, that's where someone has, it doesn't matter what you do to them, they have an abnormal perception. So they don't see themselves in the mirror, regardless of what we tell them, the same way that the world sees them. And so they don't view these things as overdone. That's very different than someone who has a different aesthetic goal. And I use an example a lot, I'm not a fan of purple hair on me. I don't think the purple hair is necessarily bad. Some people look great with purple hair. I don't like purple hair. But if somebody can safely go and get their hair colored like that, then who am I to say that that's wrong? Same thing with some of these aesthetic procedures. I think we need to screen, make sure it's not a dysmorphic disorder, make sure it's something that we can safely achieve. And the biggest thing for lips, I believe, and I just saw somebody commenting on this recently on a pretty famous injector saying, we got to make sure that they're okay knowing that they're going to be with that for a while. Because if we stretch their lips out to the point to accommodate a lot of filler, when that filler goes away, that's going to be a lot of loose skin because we've essentially stretched it. And so they're going to have to be okay with owning that look for a prolonged period. So we don't do lots of those patients in our practice. We have only a handful because in general, we want our reputation to be more natural looks. But we do have a handful of those that we kind of have fun with. Allie, do you ever do any of sorry, go ahead.
I was kind of going back to the whole safety thing, but you can ask Allie this and we'll come back to it because as soon as you said safety, I thought Hyalopin.
Yeah, I want to talk about Hyalopin, but I also want to just briefly touch on this before we go on to Hyalopin. Allie, do you do any semi-permanent fillers, things like Radius or Bellafill in the lips?
No.
Okay. And is there a reason that we don't do it there?
Yes.
Okay, Lindsay. I hope, Lindsay, you're watching this.
It's not safe. It's not something that you want to put in the lip tissue a lot of times, especially something like Radius. I mean, that has calcium in it. That's too hard, too harsh for the lips. That should be soft tissue. We don't want anything semi-permanent. It would be a disaster to dissolve. If you messed them up or if you made them asymmetrical or something you don't want them stuck with that. It's not safe. The great thing about HA fillers is that you can dissolve them if the patient's I thought I wanted this, but I've changed my mind. Lips are a big deal. I can remember the first time I got my lips injected, I was so excited, but I was like, what have I done to myself? Because I'd never seen lips on myself. Now I look back at pictures of myself before I had lip filler and I'm like, oh God, and so it's a big change for people. And if you don't like that change, it's so amazing that we have the ability to reverse it.
Yeah. And so that, again, it plays right into what we talk about with safety. So we do use products that we can dissolve if they don't like them. We have that medication to dissolve it available on hand. And we actually use products that are approved for on-label use in this area. So, it's great that we have access to that. But this brings us to the topic of Hyalopin. So, Jerry, do you want to explain a little about what the Hyalopin is?
Yeah, so it's basically a needleless system that's being used, and I hope that it's kind of losing some traction now. We haven't heard quite as much about it recently. I know there's still a few that are doing it. It's oftentimes done by non-medically trained professionals. My biggest fear with Hyalopin is vascular occlusion safety. I think as far as aesthetic results, those can be corrected, but a lot of the places that we know of that have been doing the Hyalopin or have a history of doing the Hyalopin, do they even have Hyalonix? Do they know what Hyalonix is? Are they trained? And so it goes back to what we've talked about on every single episode of this podcast we've ever done, in the safety. And at the end of the day, we want what's the safest for our patient. Mm-hmm. And I personally don't view it as a safe treatment.
So, Allie, have you had to deal with patients who've had the Hyalopin and are either happy or not happy with their results?
I think I've only seen one in the clinic that I think Jerry was treating at the time, and I was kind of helping with him, and it was not a good experience for her. She actually did an overfilled lip, or what I would consider an overly augmented lip for her face structure, in my opinion. And I think that she still likes the fullness, but it was an issue of asymmetries because you don't have the control that you have with a needle and HA filler by a medical provider. And so that's another big thing, aside from safety, is results. And you're going to get filler, but it's very likely going to be either migrated or not symmetric. And so not having that control.
Well, I think one of the things to kind of point out with that is you're correct. They're usually getting some sort of hyaluronic acid, but we don't necessarily know what that hyaluronic acid is, how it's cross-linked, how those molecules are held together, or how they're manufactured or produced, because they're not FDA approved products, so they're not distributed in any controlled fashion. And so you really could be, it's a pressure device that kind of forces this product in through the skin. And in doing so, you could be putting something in there that is not sterile, but it also, because of the pressure that it uses to inject this, it can be uneven, it can be lumpy. Now, there are people out there that I've seen that are very happy with their Hyaluron lips. And, there are some practices, some medical practices that are using this as a needleless alternative to deliver product. But to my knowledge, there's no FDA approved hyaluronic acid filler to deliver through that device. So I just want to caution, buyer beware when you're going out and getting some of these procedures done. We have seen more people unhappy with their results than we have people happy. Now, again, that may be that we're selecting out because people that are coming to us are usually coming to get that fixed or repaired. And so maybe we're not seeing all the people that are having it, they're happy with it. But just be aware of the risk of that. And know that in 2018 that the FDA did issue a warning. So this is not something we're just dealing with. That warning has been out for a few years that state that this should not be used around the lips or the eye, because if you do get it in or around a vessel that compresses it, it can be tissue necrosis or tissue death or even blindness in some cases. Again, buyer beware.
I think it's so attractive because people are so scared about the pain associated with lip filler a lot of times. And it's supposed to be, a painless, needleless, way to introduce hyaluronic acid filler or product into the lips with highly pressurized air. And so I think that was very attractive for people, and it's not worth it.
Yeah, well, I think a lot of people are afraid of pain.
Yeah.
Me included, right?
Same.
I'm one of the biggest babies. So why don't you talk a little bit about how we keep our patients comfortable for lip injections?
Yeah, so we use our topical anesthetic typically. It's a really, really good cream. We've had, tattoo artists that come in and get stuff done and they're like, where did you get this? Like, this is some good numbing cream. And so most of the time people are comfortable with that. Me personally, sometimes I like to do a dental block. Jerry knows because he's like, but no, we will do a dental block, which helps a little bit more additional numbing. And dental blocks are actually relatively comfortable. I was scared to do a dental block the first time, but you put a little bit of oral numbing cream in there on the gums, and then you don't even really feel the injection. All you feel is just like a pinch. It's blocked, and you may still feel a few pokes, but it's comfortable enough. I always tell people I'm a baby too, and it's not super comfortable, but it's nothing I'm going to go without either. It's not so uncomfortable that I'm not going to have my lips done. So, and that's a lot saying for me.
And I think the distraction techniques, the vibrating, tools that sometimes kind of preoccupies patient. We keep ours in the freezer so they're nice and cold for the patient. Ice packs that the patient can apply to the alternate side that we're working on. It kind of gives the patient a job. And then I think ice in general is a pretty good anesthetic as well. So we do our best to keep patients as comfortable as possible, even people like you.
Yeah, I've had lip filler once or twice. It's been a long time, but he usually, it's when I'm least expecting it. And then he's like, I think you need a little bit in your lips. You don't need those wrinkles. So he plants that seed and I'm like, well, let's pull them out. Do you treat any patients now, Jerry or Allie, that have had lip implants that you have to do other things because they've had them for a long time and maybe they're not exactly where they wanted them or their lips have changed over time?
I actually have 2 patients that have had lip implants removed. I think one of them started out and you treated her, and then and I've just kind of maintained her filler, and it was a challenge because of the pockets that are in the lip following the removal of the implant. And then we have another patient, and unfortunately she had a silicone product injected that cannot be removed. And she did, I just recently saw her in the clinic, and her dissatisfaction is that it's so heavy you can't see her top lip. I mean, her top teeth, I'm sorry. And
you can see the lip.
Yeah, they're big, and she said that, she's gone to 2 different surgeons that gave her surgical options, but they also told her that her lip would be disfigured when they removed it. So, she had an unapproved product that was put in, she referred to it as illegal, that she had put in several years ago. She, fortunately, she had a similar product put in her cheeks that turned out really nicely. So she's good with her cheeks, but that's my experience with the lip.
Yeah, so with lip implants too, I have very limited experience. I know the patient that you're referring to, but just like people who have filler for a long time, the implants will stretch the lips out. And so then if you have them removed or your face doesn't age in the way that you're like, and you have that removed, we're gonna have to fill that up, or you're gonna have a lot of loose tissue and a lot of loose skin there. In general, we don't see problems with a lot of reactions to this. So I don't know if people who have things like implant syndrome, which you hear a lot of talk about now from like the breast implants. I'm not saying that's not out there, but it's not something that's talked about extensively. And so we don't deal with a lot of that. We're doing more filler. So I think the good thing now is we have safe options. So the hyaluronic acid class of fillers is a safe option that's relatively short acting. The bad thing is if you like it, you have to maintain it. You have to keep it up. But it's something that's not going to be there or you can change the shape or what you like about your lips as time goes on. Is there anybody, Allie, who you would say is not a good candidate for lip filler?
It's anybody who's had like a previous allergic reaction to any type of hyaluronic acid filler. People who are, overly augmented, I may, just caution them about, like you said, you overfill and you keep it filled over that prolonged time.
Can you just talk a little bit there? Because you touched on it earlier, but I don't know that people quite got it. Let's talk about overfilling, putting too much filler, and migration. What is migration, and what are some of the factors that lead to it?
Yeah, so migration is something I feel like that's becoming more and more of a common complication, I guess. I think it's the volume too that we see of lip filler, but migration can happen whenever you're injecting outside of the vermilion border, which is going to be like that perioral region kind of around the mouth. It's a much higher risk of migration whenever you're doing large volumes of filler at one time, when those lips haven't stretched at all and they're not capable of holding that filler in the area that you've placed it, and can eventually migrate outside of the vermilion border or your lip line. So I think that's something that, and sometimes it happens, and you can do Hylenex and dissolve that filler, and then replace any filler that gets dissolved in the process. But something that you need to be very careful with. I know I've had people beg me, to do 2 syringes on them at one time before, and my last injector did it, or I moved from here, and they will, I just don't do it, because I want you to have the best result. You can come back in as soon as 2 weeks, and we can add a little bit more if necessary, or we can at least look at that option. Or you can do something like add a little bit of neuromodulator above the lip to get a better height of the top lip too, in combination with filler.
So Jerry, if you have to dissolve someone's lips, either because they're not happy with the result or it's migrated, how long can they get injections, and can they get them replaced on the same day that you dissolve them?
No. So typically what we recommend is to come back in 2 weeks for a follow-up session with dissolving. And then I like to wait at least 4 to 6 weeks to re-inject. And we were just I sat in on a class in Dallas, and this guy which is a very well respected injector, said he waits up to 6 months.
Now that's for
migration.
For migration, because
Right.
I think a really good point you're making is those paths are open. However it migrated to start with,
Right.
is going to remain open. But if it hasn't migrated and they just don't like their result, how long do you wait before you put
4 weeks.
4 weeks. Okay, Allie, are you the same? Yeah, I would say 2 weeks for me, a little bit. I'd probably do it a little bit sooner. That enzyme that we inject to dissolve the lips hangs around for a little bit, but you're gonna have some inflammation and swelling. So for sure, the longer you wait, the better, the safer you're gonna be in terms of making sure you're well out of that time frame. For me, I've always kind of said 2 weeks is where I would do that. And again, you can see the difference in each of us individually within the practice. So I hope you guys have learned a lot about lips today on this podcast. Do you guys have anything you want to add before we close it?
I don't think so. I think the main thing is stay safe. If you decide that you do want lip filler, just stay safe. Choose an approved provider, someone that's well educated, someone that has products that's appropriate for what your goal is.
Yeah, and clearly we like to provide that for you at Skin and Tonic. So go check out our website at skinandtonic.pro. Come see one of our great providers. You can see they're very well educated on lip specialists. So I think they would both do lips all day if they could. Really, they enjoy doing that. I will do them for you if you want me to. I also have done them for a while now. I finally got over the hatred that I had for doing them, but these guys definitely specialize in it. Anyway, thanks again for tuning in this week. We hope you've enjoyed this episode of Beauty and the Brain, and we look forward to seeing you again next week.
See you soon.